Hello everyone and welcome to the second session of NPTEL course in Herbal Drug Technology. We are in week 5 where we are studying the different interactions that our herbal drugs do have with the drugs, with other herbs as well as with foods that we consume. Just to recollect, in the previous session, we saw that the herbal interactions are kind of pharmacological interactions which show the desired biological effect, but however, this effect is altered due to the presence of these herbs. Now, these herbs can often interact with drugs, herbs can interact with food as well as with other herbal drug ingredients to change the biological effects, which can be an enhanced effect or which could be a subdued effect observed as a result of this interaction. Grossly, the herb drug interactions were broadly divided into two categories we called as pharmacokinetic effects as well as pharmacodynamic effect. Just to brush you all up through, pharmacokinetic effects are the effects which kind of alter the ADME or what is referred to as absorption, distribution, metabolism as well as excretion. When it comes to pharmacodynamic effect, these are the effects or these are the biological effect that we pursue in terms of activity. The effect of consuming herb with other drugs, herbs as well as foods can be additive, synergistic, antagonistic, potentiating as well as in some cases when the effects are way beyond the control, it can lead to what are called as adverse or unexplained reactions. In this session, we will see some effects of the drugs pertaining to herb drug interaction. Now, starting this session with pharmacokinetic interactions. So, herb drugs, when they are often co-administered together, can lead to changes in their pharmacokinetic attributes, and one such attribute is absorption. So, consumption of herb along with a drug can alter its absorption. That means once you consume it, it should get absorbed and go into your systemic circulation. But these herbs which we are consuming along with the drug are not letting it absorb well. There are few reasons why this is happening, and this could include disrupting the membrane. Now we know that our gut lining is covered with a membrane, and this membrane consists of your mucus layers. Now due to certain conditions or certain properties of herbs or the compounds that it contains, the membrane, especially the membrane layers, undergo perturbation or disturbances, and as a result they are more leaky or more pervious. As a result, what is going to happen? There is going to be a change in absorption of drug which is observed. Not only that, certain times we will see that drugs create a physical barrier. I will give you a simple instance. Take for example, you are consuming something which is more viscous or mucilaginous. Now imagine it like a oats porridge, or imagine it like a very mucus or very viscous isabgol which is swollen. Now when this mucilaginous drugs or polymeric drugs swell in our stomach, they form a layer on your stomach lining which is carbohydrate. So this carbohydrate mesh which is now lining your stomach doesn't let your drug go through, and that is the reason this physical barrier alters the absorption of drug. Not only that, there are certain drugs or certain herbal candidates which are known to alter or affect the pH. Now, there are drugs which are alkaloid rich, which are more alkali like, or there are drugs which are tannin or acid rich, which are more acid like. So say for example, tea is something which is rich in polyphenolic acids. So that create a pH little on the acidic side. So now if the pH is acidic, that will convert your other acidic drugs into an unionized state, and that will convert your basic drugs more into its salt form, and as a result the absorption of such drugs will get altered. Not only that, it is seen that consider you are taking what are called as iron supplements for people those who are deficient in iron, and what happens is concurrently they are administering a very tannin rich or polyphenol rich compounds. We know that tannins have a ability to form complexes with metal ions. So as a result, what is going to happen is your metal ion, especially your iron, is going to chelate with the acids or the tannins present in the drug, and as a result they will no longer be available for our body, because in that chelated form they are insoluble and they form precipitate. Not only that, there are drugs which alter the GI transit time. So normally the GI transit time is perfect for us to kind of have a good elimination within 24 to 48 hours. But consider there are people, those who are habitual to drugs such as senna, or consider people those who are habituated to drugs such as senna or drinking castor oil in the morning. What happens is for such patients, they kind of because of their laxative effect, the transit time is reduced to just 5 to 6 hours. As a result, the overall time window for which my drug was exposed to my stomach and intestine decreases, and as a result the net effect of the bioavailability of the drug is that the overall bioavailability of the drug also decreases. Not only that, on our gastrointestinal membrane there are numerous transport molecules. These transport molecules help in transportation of metabolites and hence increase their bioavailability. Now imagine your herbal phytoconstituent binding to the transport either reversibly or irreversibly. In that case, these transporters are not available for your drug molecule, and as a result they will still remain in your gut lumen and not get absorbed in your systemic circulation. So these are few interactions that you can observe that alter the absorption of drug. Now let's see few examples of this. Now the first example is what we discussed in the previous session, and that is of black pepper. Now black pepper contains this beautiful compound. It's an alkaloidal compound called as piperine, and this piperine is known to perturbate the membrane, and as a result, because it does so, along with it now the membrane which is disturbed causes more absorption of metabolites, more absorption of drugs, and as a result if you see literature, there will be numerous case reports where piperine or consumption of black pepper has been proven to increase the bioavailability of drugs such as theophylline, propranolol, phenytoin, nevirapine as well as rifampin. Not only that, it's just not piperine, numerous other compounds such as flavonoids, quercetin, genistein, naringin, even molecules such as your cinnamonine, glycyrrhizin, and even nitrile glycoside have been proven to be bioavailability enhancers. So whatever you consume along with it, especially the drug candidates, you will see more than normal bioavailability, so they will be more efficacious. But you have to exercise due caution that definitely there is going to be a therapeutic window. If your drug concentration goes higher than that, that might lead to toxicity. Now there are also few more examples from traditional Chinese medicine. So if you take a TCM, which is actually not a herb but a herbal combination, that is your danshin. Now it contains numerous herbs, and one compound which is present in this herb is your danchinol, and another compound is salvinoic acids. Now this is a group of acids. Say for example, in this one of the acid is salvinoic acid B, which is essentially a acid polyphenolic compound. Now it is seen that because it is acid polyphenolic compound, it has lot of what are called as anionic charges, negative charges. So this molecule salvinoic acid will bind to what are called as anionic transporters. Now two good example of this are your organic anionic transporters T1 and T3. Now this is what is involved in also the transportation of drug called as metformin. Now metformin is a drug which is commonly prescribed for diabetic patients. Now imagine if your salvinoic acid is going and sitting on OAT 1 and 3, these transporters have already been blocked by the danshin, and what happens is now your metformin is no longer or cannot be transported, and as a result it remains in your gut lumen. Now salvinoic acid per se does not have any anti-diabetic effect, and as a result the overall effect will happen is, since your metformin is not reaching in your systemic circulation, your blood sugars level will still remain elevated. Not only that, a good example of drugs that decrease your GI transit time is laxatives. So imagine your drug is there, but it needs some time up for absorption because the transportations are limiting. They can carry a particular molecule or particular number of molecule per unit time. So more is the residence time, higher is the chances that they will get transported. But imagine if I am administering a laxative such as your castor oil or senna tablets, what is going to happen is that is going to irritate my GI mucosa, and as a result my transit time will really be quick. Within that transit time, my transporters will not be able to absorb as well as transport so many molecules, and as a result the net amount of molecules that reach my blood decreases. Not only that, even if you consume diets, now we all know that your gummies and jellies contain molecule or carbohydrates such as pectins. Now pectins, when they are administered, they tend to swell in your stomach and they form a lining. This lining is the one I discussed. Now because they are polymeric in nature, they will form a mesh which will kind of coat your transporters, they will coat your membrane, and once they are coating the membrane, my drug molecules cannot seep through it, because in order to be bioavailable they have to pass through this to reach your bloodstream. So as a result, you will see in one such study is done in your chicks was the pyridoxine which was administered along with pectin. It was seen that because of this pectin barrier, the amount of pyridoxine which was absorbed decreased, but the amount of pyridoxine in the fecal matter, that is the unabsorbed one, definitely increased. Another cases of ADME is distribution. Now not only does your herb disrupt the absorption, it might intervene at a distribution stage as well. So how does it intervene? So we have seen in the previous session that whenever a drug is getting absorbed, the next step is, or the very vital function of the blood is to distribute it to your different organs. Now this happens by direct transportation, or this happens by certain proteins. Now there are certain proteins such as albumins, globulins which are already floating in blood, and there is a good chance that majority of the drug molecules will take this albumin globulin bind to it, and many of them, as we saw previously, maybe even as high as 90% protein bound. Now there are molecules such as psilibin or psilibinin which are there in drugs such as milk thistle. Now milk thistle is commonly taken for liver detoxification. Now this flavonoids also have a ability to bind to this albumin. So what happens is there is a good fight or good competition between your drug molecule as well as your psilibinin for your same site on the albumin. The net effect is my molecule, that is my drug, is not going to bind, maybe my psilibinin wins. In that case, what is going to happen is instead of 90% binding, I might just get 50% binding, and it will throw that much more molecules into free systemic circulation in its unbound stage. That will decrease its residence time as well as potentiate its effect, which may even lead to a lethal adverse effects. Not only that, you will see that in your distribution chain or in your blood, there are certain blood cells, especially RBCs, which are more numerous. They have a good permeability for drugs such as metformin or even if you take, or if you are talking about antidepressants, tricyclic antidepressants, especially imipramine, has a good tendency to bind to RBC. Now imagine if your herbal phytoconstituents also have or show the similar ability. What is going to happen is they are going to kick off these molecules from the RBC, and overall these molecules will now be in the bloodstream, leading to kind of potential enhancement in the effects of the drug. Another place where the drug gets distributed is during the time of distribution in our body, there are lipid rich regions. Now what happens is this lipophilic drugs have a good tendency to go via the distribution channel, that is your blood, and go on accumulating into the lipoidal region. Now this lipoidal region then forms a fat reserve for this drug, and slowly over a period of time the drug diffuses. The dose of this drug is calibrated based on that. Now say for example you are consuming a drug which will cause depletion of this fat deposits. Now there are herbs that promote thermogenesis such as coleus. It will cause burning up of ATP. So if it is burning ATP, our body will require more energy, and this energy it takes from fat molecules. So your fats are dissolving, or your fats are sacrificed to produce more ATP. But when the fats are sacrificed, the drug which was initially deposited in those fat is also released. So we need to be careful about that, and not only just thermogenesis, there are also drugs like Google which cause adipogenesis. So as such your adipocytes, whatever the depositions of the lipids will be there, that is depleting when you are consuming drugs like Google. So those which are getting accumulated will also decrease, and overall the efficacy of such drugs will decrease. Now your certain drugs are also involved in what is called as affecting the bone binding. Now bones generally are a good site for minerals absorption. So your calcium and most of the minerals get deposited on the osteoclasts, and that's a very good thing because that is important. Now if imagine hormonally you are taking something which are like hormonal supplements, or which are called as your phytoestrogens. In some cases they are known to alter the bone reabsorption of minerals as well as certain elements. So yes, herbs also are reported to affect the distribution, not just absorption but also the distribution of the drugs. Coming to the third cases of ADME, that is your M for metabolism. Now herbs affect the metabolism of drug mostly by two processes. The very first one is enzyme induction, and second one is enzyme inhibition. So enzyme induction means more enzymes. So the quantity of enzymes increases in your enzyme induction. So what is going to happen? More the enzymes, higher the metabolism. Higher the metabolism of drugs, that will lead to decreased concentration of drugs, and decrease in concentration of drug will lead to decrease in pharmacological effect. So the net result is enzyme induction causes decrease in pharmacological effect by decreasing the amount of drug available. Now you consider the opposite case. If it is enzyme inhibition, if the enzymes are inhibited, it is going to lead to increased concentration. So here are few examples. So say for example, people often take hypericum or St. John's wort for mood elevation. Now this St. John wort which they have consumed for mood elevation induces, you remember induces means increases enzymes such as CYP3A4. Now this CYP3A4 is one of a very vital enzyme which is known to affect the metabolism of cyclosporins and a cardiac drug called as digoxin. So what is going to happen? There are going to be more enzymes which are there, and that will lead to more metabolism of this drug. More metabolism means they will be inactive, they will be thrown out of the system, and since they are thrown out of the system, their net pharmacological effect decreases. Coming to the invert case, enzyme inhibition. Now enzyme inhibition means lesser enzymes are available, or few enzymes are available, or no enzymes are available. In that case, what is going to happen? This metabolism of drug will also not happen, and as a result my concentration of drug increases. Now if my concentration of the drug increases, the net result is the pharmacological effect is also enhanced. So my drug is going to stay in my blood for a longer duration of time, and it is going to show me a higher pharmacological effect. So again an example, that's your milk thistle which is discussed. Now this exactly does opposite to CYP3A4. Your St. John wort induces it, whereas milk thistle inhibits CYP3A4. Now what happens? Your bioavailability of cyclosporin increases. Same will happen to your digoxin. So yes, pharmacokinetic interactions also affect the drug metabolism, especially the herb drug interaction, and this mostly happens by enzyme induction or inhibition. Coming to the fourth case of ADME, that is your elimination. Now elimination of the drug in the body happens by biotransformation, and biotransformation we saw occurs by phase 1 and phase 2 reactions. Do you all recollect? Phase 1 reaction was what is called as your functionalization reaction, and in functionalization reaction you attach what are called as different functional groups to make your molecule more polar, whereas phase 2 reactions are referred to as conjugation reactions, where few sugar like glucuronic acid like conjugates are added to it to make the molecule still more polar, so that the excretion is facilitated. Not only that, there are another additional mechanism which includes efflux. We will discuss in the previous lecture, that is your P glycoproteins, which remove the drug outside the cells. So say for example in this case we have an example of hypericum, which is again your St. John's wort, as well as your curcumin, which is present in your turmeric. They are known as PGP inducers. Now what does PGP inducers do? PGP inducers means more. So they will increase the amount of PGP. So P glycoproteins will be enhanced, and what does that means? If P glycoproteins is enhanced, more amount of this drug will get transported outside the cells. So anti-allergic drugs such as your fexofenadine or even anti-cancer drugs will be thrown out of the cells, and the net efficacy of that will be increased. Not only that, the second case is we saw is diuresis. So in this we have an example of dandelion. So dandelion extracts are given as anti-inflammatory. You will see even a horsetail, birch or nettle have also diuretic properties. Even your tea is known to be a diuretic. So in that case, when it causes a rapid elimination of water from the body, it takes along the electrolytes. And imagine your drugs which are affected by the electrolytes concentration will also be affected because of it. So this is how your ADME properties are seen, or ADME interactions of herbs are seen with drug. Now coming to your pharmacodynamic interactions, if you recollect this slide, we saw in the previous session pharmacodynamic interactions can be additive. You remember 1 plus 1 is equal to 2. That means the effect of both of the drugs are added. They can be synergistic, if you recollect, more than addition, antagonistic. So the net effect can be nullified, or the net effect can be on the either side depending upon which is more stronger candidate. Potentiation, when the other interacting herb has no effect as such, but overall it enhances the effect of drug. And last case is adverse reaction. I don't want a biology here, but the effect what is occurring here is something which is not desirable and decreases the applicability of my drug. So, let us study few case studies here as well. So, pharmacodynamic interactions mainly herbs show by additive, synergistic, potentiation, and we saw antagonistic effects also. So, talking about examples here, say garlic. Garlic is known to be kind of inhibitor of platelet aggregation. So, imagine a herb which is inhibitor of platelet aggregation, which is acquired for your clotting and taken along with warfarin, which also interferes with the blood clotting mechanism. What is there is the patient is at much increased risk of bleeding. Now, examples of synergistic effect where you will see 1 plus 1 is equal to 3 is observed with sugar. So, people those who have elevated blood sugars often take herbal supplements. They take your Karela extracts, they take your Gudmar, or they take your Tinospora extracts and so on. And these extracts they often are also administering drugs, allopathic drugs such as metformin. So, what happens is already your sugars are low because of the tablets and you are consuming something which is more herbal and also known to decrease the blood sugar, and in some cases also give rise to insulin sensitivity. Now, this decrease in sugar level and increase in insulin sensitivity can cause more than additive effect and your blood sugar levels might drastically drop down. So, you need to be careful with that. Similarly, you need to be careful with drugs which is diuretics. So, say for example, you are consuming drugs which are diuretics and then you are consuming something like your tea or an extract which is also diuretic. So, that will lead to heavy loss of minerals such as sodium, potassium from your body, and as a result the effects may be much more than enhanced. We call such effects as synergistic effects. Now, the third case was potentiation. So, we saw that somehow your licorice can increase the concentration of corticosteroids. Now, licorice does not have corticosteroids, but licorice is known to indirectly increase the concentration of drugs such as prednisolone by more of a retentive or different mechanisms. So, it potentiates the effect of prednisolone when administered. Not only that, you have to be very careful with the immunomodulator drug that is there in market, that is your ginseng. It is a common ingredient of your supplement called as Revital. So, this if you are taking it with antidepressant drugs over a period of time, it potentiates the effect of antidepressant. So, as such ginseng is not really an antidepressant, it is more taken for immunomodulation. But when taken with antidepressant, it is known to give you what is called as, or it is known to potentiate the effect of antidepressant drugs. Now, going to the mechanisms of pharmacodynamic interactions, they generally happen by receptor binding, or say for example, why do pharmacodynamic interactions happen? So, pharmacodynamic interactions generally happen when two moieties, that is the phytoconstituent as well as the drug, they try to bind to a same receptors. We saw it the competitive, non-competitive, or in the uncompetitive form. So, this receptor binding causes a effect or a net effect. Now, this net effect can be a additive effect or this net effect can be a counteraction. Now, counteractions in pharmacodynamic effect is generally said when the herb that we consume has a very opposite effect. So, we saw additive, we saw cases where the effect is additive, like additive, synergistic as well as potentiation. But when the net effect is opposite, here in this case you will see that either there is a nullification. So, there is a positive CNS stimulant as well as CNS depressant, the net effect is no effect on CNS, or if the drug is stronger than that, so there is a CNS stimulant, CNS depressant, but I will need to administer a higher dose because some dose is counteracted by my pharmacodynamic strategy. Now this strategies, like I said, can involve receptor binding, competitive, uncompetitive as well as non-competitive form. Examples of this include genistein. Now genistein structurally is known to mimic estrogen. Now you will see that people, those who are having breast cancer, they often take a drug called as tamoxifen, and that is known to bind to the same estrogen receptor. Suppose if you are consuming soy supplements which is rich in genistein, what is going to happen is your genistein is going to bind to the estrogen receptor, your tamoxifen will not be able to bind, or there will be a competition. And in that case, what is going to happen is the effect of tamoxifen is decreased. So yes, there is going to be an antagonism because your soy is more of an estrogen mimetic, whereas what we want is we want to bring the effect of estrogen down by administering tamoxifen. So some counteraction is anticipated here. Not only that, there are cases where you can see physiological antagonism. So here the receptors are different, it is not same, so it is not going to be competitive, uncompetitive type. The receptors are different at different stages of the pathway. That is the different stages of metabolic pathway, say for example your blood clotting, or different stages of blood pressure pathway, or even take for example different stages of your cancer cascade pathway. Now what is going to happen is one is kind of enhancing it, one is kind of depressing it. So the pathway is struggling, and that is what we call it as your physiological antagonism. So licorice increases the BP, antihypertensives decreases the BP. So physiologically they are not binding to the same receptors, but because they are acting on blood pressure, the net effect on blood pressure is seen. That kind of antagonism we call it as the physiological one. So pharmacodynamic interactions again include further signal transition. Now we have seen here that it could be receptor binding, it could be physiological antagonism. The third case is signal transduction. So if signaling pathways are triggered, say for example your cascade pathways is triggered. So say for example here we have examples of anthracyclines or even platinum compounds or alkylating agents. Now what they do is they trouble the pathways in cells to generate more free radicals. So more the free radicals, more this free radicals will kind of affect the cells, and if it is a cancerous cells, this free radicals will cause death of cancer cells. But imagine along with anti-cancer therapeutic agents, you are taking antioxidants. People with cancers often take antioxidants. So what happens is theoretically you can see this drug is trying to generate oxygen, free radical oxygen, kill the cells, and these antioxidants are trying to kind of counteract that oxygen and not wanting to sacrifice even the cancer cells. So that there is a good kind of what is called as antagonistic interaction. So yes, antagonism also exhibits via different mechanisms. So your herb drug interactions can be pharmacokinetic type, they can be pharmacodynamic type. So you need to take all due precautions to see how is my drug getting absorbed, how is my drug getting metabolized, distributed and excreted, and then beyond that what is the mechanism of my action. Then you compare it with the herb that you are administering. How is that herb getting administered? How is it getting ADME, that is the pharmacokinetic parameters of it? How is it showing the biological effect, that is the pharmacodynamic parameters of it? And then compare the two. Is there going to be any interaction, similarities or difference? And then you will come to know if your candidate matches or not. Not only that, in the previous session we have seen different websites. You can check on that, and based on that you can counteract or save yourselves from this kind of interactions. So here are a few more references. If you wish to go through or understand the mechanisms behind the examples which are cited in this session. And thank you everyone for your patient listening. Thank you.